an opportunity that we would make available to the public for people to get on and ask those questions. I'm going to turn it over to Glenda Silva, who is going to moderate the session for us. And we thank both Dr. Bakari and Dr. Moise for being here this afternoon. And go ahead, Glenda.
Great, thank you. Thank you, Lori. Good afternoon, everyone. My name is Glenda Silva, and I am Deputy Director at Brooklyn Borough Hall. And I just want to thank everyone who has joined us for today's session. I would just like to highlight a few the following ground rules. They're not a few, there's just several. First and foremost, the session is currently being recorded. Everyone will be muted except for the guest speakers, who will introduce themselves shortly and speak on the impact of COVID as it relates to their specialization. Prior to the session, we received several questions from constituents. The questions will be read by either Lori Lewis or Mike Moutal. If you have a question during this very session, please submit your question in the chat function. Lori or Mike will review the questions and will ask some from there as well. If you feel that your question has not been addressed, please email your question to askeric@brooklynbp.nyc.gov. And before we move on to our speakers to introduce themselves, I'd like to share a special message from the Borough President himself.
Changing my diet literally saved my life. I'm Brooklyn Borough President Eric Adams. I was diagnosed with type 2 diabetes. I had nerve damage in my leg and my hands and feet. I lost vision in my left eye. I was told I would be on medication for the rest of my life. That is when I researched and learned food was the leading cause of my condition. I changed my diet to a whole food, plant-based diet filled with whole grains, beans, vegetables, fruits, nuts, and seeds. And I reversed my type 2 diabetes. And as we have seen the last few months battling the coronavirus pandemic, health matters, and information is key. That is why I've begun a conversation on health, introducing our Wellness Wednesdays series, featuring doctors from around Brooklyn specializing in general, internal, and emergency medicine, as well as pediatrics. So please come join me and bring your questions. Want to know the best way to access in-person care? When to visit an emergency room and when not? When and how to use telemedicine? When to take your child for routine appointments and vaccinations? And how to do all this during COVID-19. Please take advantage of this opportunity to learn and address your family's health by speaking with a special group of Brooklyn doctors. They are here to listen and inform. And who knows, the information you gain might help save your life or someone you love.
Thank you, BP. And now I'd like to turn over to introduce our guest speakers for today. We have Tamara Moise. She is an emergency room physician and urgent care center owner. And we have Dr. Nicholas Bakari, who is also an emergency room physician from Methodist Hospital. I would invite you both to take the floor and share a little bit more about yourselves and the impact of COVID. And Lori and Mike will read questions as they come up. Thank you.
My name is Dr. Tamara Moise. I am an emergency medicine physician. I've been practicing as an attending physician for over 10 years. And I also am the co-owner for Big Apple Care, which is located in East Flatbush, Brooklyn. Currently I am working in the emergency room, and I'm also running and working in the urgent care as well. So I definitely had a lot of exposure to COVID patients, and actually in both settings. So of course, definitely in the emergency room for sure. And Dr. Vakari, I know he agrees with me. That was quite an experience. And of course, COVID is still out there, so we are still dealing with it to some extent. But thank God it wasn't to the extent of what was going on several months ago. But I would say from the urgent care standpoint, things were very different in the sense that typically people that come to the urgent care are folks that have minor illness for the most part. But when COVID was hitting us hard, especially in March, April times, we were actually receiving a lot of patients that were that were severely ill, that actually should have been going to the emergency room, but a lot of people did not want to go to the emergency room. So I had to do a lot of preparation here in terms of just making sure that I had proper PPE, which was a struggle, but we were able to fight and get some. And also I had to get extra oxygen tanks. So it was a really really different situation for any urgent care to deal with. But thank God I'm an emergency room physician, so I know how to deal with these things. But it was definitely a huge change. But we accommodated and did the best that we could. And of course, the emergency rooms, I'm sure Dr. Vakari, he'll tell us a lot with that. That was very, very difficult as well. We've just never seen so many severely ill people at one time, so many people that were intubated, that were connected to life support. We had never seen so many of them at one time being in the emergency room. So it was really a difficult time. Thank God the numbers have gone down in New York, so things are better, and we're hoping to keep it that way.
Well, that's a hard act to follow, but I'm surprised that we haven't ran into each other sooner, because as well, I'm 10 years out also that I've been practicing emergency medicine. I'm originally from Brooklyn, from the Sunset Park area, and went to, school through here my life, and actually served in the United States Marine Corps for a couple of years, and then came back, went to college, and then was lucky enough to go to medical school, and really it is truly a pleasure that I get to do what I do here in Brooklyn, and I don't want to go anywhere else if outside of Brooklyn. So to me, it's near and dear to my heart. And when COVID came, I mean, it was like almost like the days before a hurricane, when you know that the storm is going to hit. And I think it gripped and it touched and affected everybody in this city in some way, shape, or form. Everybody knew somebody, was close to somebody, or even had it themselves. And the variety of what we were seeing was different than any other virus I've ever seen in my career. And really from my colleagues that I've spoken to, they were in the same way. And in the sense that it was so novel, it was so new, that somebody who is a brand new in their training knew just as much as somebody who's been practicing for 20 years, in a sense. And that posed a very interesting, dilemma as far as how we go forward and how do we treat this. What are going to be the mainstays of treatment? There wasn't a lot of information out there. It was very difficult to get information. This has been very politicized. It was the most politicized medical issue that I've ever seen, at least in my, career in my life. And that's something that we weren't, I don't have the tools to deal with the politics of it. I want to see what the science is, and not really, I want to make sure that people are getting better. I want to see how I can help people out. It got to a point like Dr. Boise said, there were so many, we were so inundated with people that were in such severe respiratory distress that it was really hard to keep up. And I'm just so grateful for the team that we have here, and for the respiratory therapists, for the nurses, for the people that were, the ancillary staff. There were times when, you said goodbye to your loved one at the door, and that was it. You weren't seeing them again. We were doing FaceTimes, and, I had nurses that, sat and held people's hands while they passed away, because they're family wasn't there. You know, it was a really challenging time, I think, for us as a community. And, you know, but, you know, look, we did get through it. And I'm, like I said, I'm very lucky that I work with the #1 hospital in New York City, by the way, you know, #4 in the country. Just want to plug it. and you know, it's, you know, I really have to say it's, you know, we did a lot of things that were things that we never did before. And, you know, we utilized and leveraged technology that we haven't utilized and leveraged in the past. You know, telehealth visits were something that were very difficult, and we were able to get that up and running. We were sending oxygen concentrators to people's houses, so you didn't have to come into the hospital and be away from your loved ones. We continue to learn from what happens, and, you know, we're preparing. We're preparing if this, you know, does come back in the fall, and God willing, I'm going to say it's not going to, and I'm just going to put that out in the world, and I hope that takes hold. But, you know, a hope is a very poor strategy, and we're trying right now and working up different things to make sure that we keep the people of Brooklyn safe. Is that enough?
Yes. Thank you. Thank you both for that. And thank you for saving lives, taking care of lives. So would Mike and Lori like to share the floor and maybe ask a few questions that were provided by some constituents?
Sure.
Thank you.
So kind of on what Dr. Bakari was talking about, that we all hope there's not a second wave. But one of the questions is, do you think New York City hospitals are equipped to handle another wave?
So, you know, it depends on how bad the wave is. And I can tell you that we're running through scenarios and we're preparing. I can also tell you that we have, you know, some of the changes that has occurred since COVID is we have an attending physician that's at the front door with a registered nurse. Those are the people that are greeting patients. Those are the people that are really doing a quick assessment. If they have any type of infectious type complaints, we have a dedicated and focused area that's separate from the main ER that we're working those patients up. You know, we're following standard precautions and really paying very close attention with our environmental staff who's engaged in really making sure that they're keeping our area clean. So, you know, we're going to fight. We're ready. Depending on what it throws at us, I do believe in at least in my team, I believe in them. And I believe in what we can do as a community.
I I also would like to say too that, I mean, of course, we had to learn as, you know, we had to kind of just learn as we go, unfortunately, but at least we've learned something at this point. So just the knowledge that we've gained in this short amount of time is helpful in of itself as a preparation for, you know, for the next wave. And I can say from the urgent care standpoint, you know, I'm basically just waiting. I have all my PPE ready. Of course, we're still wearing PPE, but I have, you know, I've just made sure that I've stocked extra, not knowing what's going to happen. And then, of course, too, like we've been doing telemedicine. We introduced recently. So for those that are uncomfortable coming into a medical environment, at least we can speak to them over the phone. And then here at the urgent care, we've taken as many precautions as possible. Social distancing, we just have just a few chairs in the front so that no one is sitting close to each other. If anyone comes in, we just try to separate everybody as much as possible. We'll send them straight to the exam rooms, or keep just very few people socially distanced in the waiting area. And so we are, you know, definitely, I pretty much expect a second wave. Dr. Bakari probably agrees. I don't want one, but we certainly have to act like one is coming. I think that's really important. So, so that's what we're doing. And then also too, we are doing free COVID testing, free to the patients. That's what we're doing now. So of course, the more we do that, the more we could prevent a bad wave to come. A wave may come, but at least we, you know, the more that we know, the more testing that we do, the better the situation is going to be in the near future. So we're doing free testing at the urgent care. We're also we are actually doing some COVID testing in the community. So we are working with a church. In fact, this Saturday at Byways and Hedges Church in East Flatbush, we're going to be doing free COVID testing for those who don't have insurance. It will be no cost to you. For those that have insurance, we will be waiving the copay. So, from the urgent care standpoint, from the emergency room standpoint, we're basically, doing everything that we can to make sure that if this comes again, that we can handle it.
That's awesome.
That is awesome. Another question from the RSVP is, and I think you two are the right doctors for it. If I think I have COVID, should I go to the emergency room or to urgent care? Or does it matter?
One option is to check your local urgent care to see if they do telehealth visits. But going to the urgent care, especially if I think the main thing is that if you think you may have COVID, but you're not severely ill, then you can either try, call your local urgent care or your primary care doctor and see if it's necessary to come in or not. Because if you have mild symptoms, then it could be something that could be discussed on telemedicine. And during the call, if the doctor sees that something more serious is going on, then they may ask you to come in to the urgent care. But probably, just calling the local urgent care or your primary care doctor is probably the best first step. Running to the emergency room probably is not the best first step, especially if you're not having severe symptoms. So that's kind of, my general, I think that's my general advice for that.
And I would say that as long as you seek some sort of help, whether it be the urgent care or the ER, we're pretty advanced, I think, in both situations about our infectious disease and our control and how we're separating people. And just come wherever it may be. If it's the ER, if it's your doctor's office, if it's a telemedicine visit, the thing that has happened over the last 5 months is that we've become separated as a society, and we have to find other ways to bring each other together. And if that's the urgent care or a televisit or the ER, just reach out.
Definitely.
Trust yourself. You have an innate sense. People are smart about their health. They really
are. They are.
Trust that inner instinct, and you follow it.
I think that's very true. And just to add too, from the emergency department standpoint, while we're on this subject, I think it's important for people to realize that if you are having any issue right now, you should be a lot more comfortable going to the emergency room than like 3-4 months ago. What's happened is that we did early on, March time, we did caution people to avoid the emergency room, and and the patients listened, and they listened very hard. So at this point, though, I do want the public to be really clear, because you have a lot of patients that did not, that have chronic conditions that did not get these conditions taken care of during those months simply because their primary care doctor wasn't available, things of that nature. So now they're presenting to us with, some people are pretty sick. If someone has diabetes and they were not, and if they were not taking care of themselves properly during those 4 or 5 months and they weren't getting checked out, they could be pretty ill at this point. So if you're sick and you need to go to the ER, you have to go to the ER. There are a lot of, here at the urgent care, I had a patient today that may have been in diabetic crisis. And she said, and I told her, listen, you're going to have to go to the hospital. The emergency room is the only place that could treat you with the situation that you're in. And she was just like, well, I really don't want to go. I'm not going. She's like, I'm not going. My husband just died. I heard that when you go to the ER, you're basically gonna die. And I had to explain to her that I said, listen, the numbers of COVID, the number of people in New York that have COVID-19 is significantly lower than what we had back in, March, April. So in fact, this is a good time to come out and get care because the numbers are so low. And plus the emergency rooms are making a lot of effort to make sure that that they're social distancing and that they're doing the proper cleaning, and that if anyone does have COVID, they are in a separate area. So they're it's nothing like before. So if you are really ill, especially if a chronic issue, if you have something really serious, and it warrants an ER visit, you really should come. Please don't be afraid.
I think that segues well into the next question. Not so much about the emergency room, but one of the questions is, I am 81 years old and I am in the process of having a colonoscopy and an endoscopy on the same day. Is it safe at this time?
I would recommend going forward with it. Yes, absolutely.
I 100% agree due to all the things that I said earlier. Once again, we're in a situation where our numbers in New York are quite controlled. And, if you were in need of a test that did not get done in the last 4 to 5 months, please go out and get it now because this is a good time. The numbers are low. All the medical offices are taking deep precautions. So definitely you should go.
On top of that question, doctors, both of you, I would imagine that now that the numbers have gone lower and we have less people in the hospitals, those who are going for special surgery would be isolated from anyone else. The COVID patients would be isolated in the hospital much more than they were before, correct?
Absolutely.
Yes.
I mean, just to put it into perspective, every patient that gets admitted to the hospital is getting a COVID swab. Before they go anywhere, we know their status. If you're getting any surgery, they're checking your status the day of surgery and beforehand. So, there's a lot of steps that are being taken to make sure that patients are separated and that people who are requiring those procedures that they've put off for the past 5 or 6 months, that this is definitely a time to re-engage at the hospital, to re-engage with your primary care doctor or surgical subspecialist or whatever medical specialty that you're going to.
Thank you for that. Mike, I know we have some more questions, but we have a few people on the line here that I can see. Maybe some of them also have questions. If you do, just raise your hand or let Glenda know and she'll unmute you.
Where are you, Delilah?
Delilah's on mute.
I could ask a question from the chat in the meantime. Do the doctors recommend getting tested before attending a social event, such as a block party?
Well, that's a very difficult question. Now, first of all, what do you expect to get out of that test is what I would say. And are you going to self-quarantine if you are? And if you are having symptoms, why aren't you self-quarantining? And maybe it's just not the best time to have a block party with more than 10 people. And, so I don't think that so you have to understand that this test, there is limitations to it and it's not 100%. So testing yourself and feeling like that's it, I am completely free to do whatever it is that is in my heart's content, I think is a bad and poor strategy. So is it a bad idea to get tested? No, I think it's great. You can get tested, I'm sure, with Dr. Moisey's place. You can do antibodies and you could do a swab test. And I think that's a very important, undertaking. As far as like swabbing before going to a party and then feeling that you can be at that party without any, kind of social distancing and without really making sure that you're keeping your hands clean. I don't know if that's something I would recommend.
I 100% agree with what you're saying. One thing, so first of all, I don't think a block party is a great idea right now in general. Unless you're keeping it very small, like you were saying. And also too, like you were saying, if you do have a negative swab result for COVID-19, you still have to protect yourself. You still have to take all your precautions. You should not let your guard down. Even when I'm doing antibody tests, if somebody does have antibodies, once again, we don't know how long these antibodies are going to last. We don't know how strong they are, how much protection that they're actually giving you. Everyone still has to be just as cautious as we were several months ago. That's my take on it. And of course, getting tested before you go to any function, it's a pretty good idea, but just make sure that the function is not too crowded to begin with.
Hi, so I just wanted to clarify the question a little bit more because I did have people asking in terms of some people are now requiring if you're going to birthday parties, proms, or anything that you get a COVID test before you come. They're asking the guests to get COVID tested before they come to that social event. So just wanted to clarify that, like, as it said, the test could come back negative, but you can be contagious the next day, right? So there's nothing that's really, so it's kind of like a myth that's out there that if you get the test, then you can just go free for all. And I just wanted to get clarification on it.
Yeah, well,
Yeah.
And I mean, I think that getting tested is helpful. It's not 100%, but it is helpful in the sense that if no one had any testing at all, you could have positive people and would have no idea. At least you can catch a few that may be positive. So it's better than nothing. And you have to understand we're in a situation where, nothing is going to be 100%. We're just doing the best that we have based on where we're at in this process, so.
My question is, even if you get a test, what's the actual turnaround time? I've heard everything from 48 hours to 2 weeks. So I'm not sure, what is the turnaround time on test results?
It depends on the company. There are multiple tests out there. I would say the most common tests are the tests that we, on the outpatient basis, at least we'll take the blood and we'll send it to a lab. And it may take, I would say, up to 7 days. By me at Big Apple, we try to keep it at 3 to 5 days at most. And however, in the hospital setting, depending on which tests are available, some they may have rapid tests that may come back in 15 minutes. There are other tests that may take up to an hour. So it really depends on where you're getting the test and which actual test that they're using.
So for us, we do have a rapid test that is really just dedicated for inpatients, acute care surgery, L&D, if you're having a baby, because there is a finite amount of reagents and finite amount of space on those machines. And typically those are anywhere between an hour and 2 hour turnaround. That's our rapid test. Otherwise, we are experiencing about 24-hour turnaround time throughout the system.
Thank you. Mike, do you have any more questions?
Yeah, I have another question from the RSVP list. Do we know can a person who tested positive get COVID-19 again? And what precautions should they take?
I don't think there's a lot of clarity on that as of yet. I don't think that there's been some case reports that people have recontracted the virus, specifically in Singapore and South Korea. And so there's a handful of case reports, and I'm not comfortable in saying for certain whether you can or you cannot, as well as if you have the antibodies, can you still contract COVID? there is some evidence that's saying that you're safe, but it's still too early and it's too young in this process to really give concrete answers about something like that. So you have to protect yourself and really standard precautions is basically what everybody's saying at this point in time.
Yes, definitely agree with that as well. I would say in the US, according to the CDC, from what we know, there are not any official reinfections at this point. However, just anecdotally, I've heard a few cases where it is a possibility that a few patients may have actually contracted again, but this is anecdotal. This is not anything that these are not like official case reports or anything that's studied. But I agree. I mean, unfortunately, we're just in a situation where we're still learning about this whole process. We're still learning, so it is unclear if people can get reinfected. We still just have to. I mean, so by the way, I actually had COVID-19 myself. A lot of my colleagues did, and we still are taking our precautions because we don't know if we could get it again. So that's the mind frame that I'm carrying, and I advise that everyone else thinks in the same manner.
That makes sense. Another question from the RSVP list. Do the flu and/or pneumonia shots assist in the prevention of COVID-19? And do you still recommend getting them?
They don't, no, they are not, the flu vaccine and the pneumonia vaccine are not specifically, do not specifically prevent COVID-19. These are completely different bugs, as we call, or organisms, so the flu is its own virus, COVID-19 is its own virus, pneumonia is its own bacteria. So, however, in general, yes, I think that everyone still should be getting their flu shot and getting the pneumonia shot when appropriate, age appropriate, simply because you just want to keep yourself as healthy as possible in these times that we're in, where coronavirus can attack immune systems that are decreased. So I think that it's still a good idea to be getting these vaccines. However, these vaccines are not targeted towards COVID-19. They are targeted towards flu and towards pneumonia.
And I'm going to be getting my flu shot this year. I just want to put that out. And I do also, the folks that I'm, and my family, friends, and people who I'm close to, they definitely would recommend, the Pneumovax as well.
And just to piggyback off of that as well, I think that this is a time for us to just optimize our health, period. So if you have diabetes, this is the time to make sure that your sugar is controlled. If you have high blood pressure, this is the time to make sure that you're on your meds and that you're keeping track to make sure that that your blood pressure is under control. Because in general, the less you control your chronic conditions, the higher chances that you have of getting sick, period, whether it's with COVID, whether it's, being in diabetic crisis or having a high blood pressure emergency. So in general, optimizing our health, exercising, eating right, losing weight, all that stuff. We should be doing that anyway, but I think this is especially the time to be doing it.
And that was a great story that Eric Adams shared, right, in the beginning, about how he took care of his diabetes, took care of some of his ailments with whole foods and not staying away from some of that, the high fructose corn syrup and the super high processed things. It's amazing what whole foods can add to your lifestyle and your diet. It's I can't express strong enough how important that is to keep up on those dietary requirements.
100% on board with that.
We believe it really is working for him, because if you've seen throughout this COVID pandemic, he's been out in the street every single day. I don't know where he gets the energy, the stamina, but he is really, taking care of himself and trying to take care of our community. So
Well, we want to see him down here in Park Slope.
we'll definitely have to let him know.
Hi, everyone. I had my hand raised. I'm not sure.
That's fine. Yes.
Can I go ahead?
Mhm.
Yes. So I'm a health coach, and just to piggyback on what Tam, well, I see Tam's iPhone. I came on a little late. I'm sorry. So my thing is, I really so much want to go into the fact of prevention. Like we know, especially in our neighborhoods where our community members are stricken by diabetes, high blood pressure, obesity, and I work in a setting where I am able to be a help to the doctors because they're so busy. I'm able to be a help to the doctors to coach these patients into living healthy lifestyles, and whether it's teaching them how to read the nutrition fact labels to really understand how much sugar is in something instead of just going by it says low sugar. One of my questions, I did post a question prior to the meeting, but I was really hoping to hear if we're going to have more health coaches on staff, especially in our low income areas where, whether it's the hospital, Kings County or downstate, wherever, so we can also help in bringing down this issue.
Great idea.
I don't know. I'm so a fan of what the borough president is doing, and I've been to some of his meetings at Borough Hall in regards to, really getting the community to know more about that. But I would really love to hear that, yes, we're now gonna maybe hire or think of having our patients see a health coach to really help with the long-term, fixing of these issues. It's not just about taking the medication.
No, absolutely. So first, I applaud you for doing what you do as a health coach. I'm from a West Indian family. I'm Haitian, and I grew up. I grew up in a way where my parents encouraged, the eating healthy and herbs and things of that nature. So, so I definitely think what you're doing is very necessary. And I think that I agree with you. I think that there should be more, more education, more programs, more, folks in wellness like yourself. Definitely, in the hospitals would be a great place to start that. Of course, that's something that, I'm not on hospital administration, so that's something that, that probably would have to be presented to the higher ups at the hospital. But right. Definitely, I'm in East Flatbush, and I'm a small urgent care, mom and pop style type of a place. So I don't have the funding to right. get to be honest with you, I don't have the funding to get that type of a program on board. But I do, I do my best when I'm speaking to my patients to help them to understand the importance of just losing weight, like how important that is, like how that just kind of can cure a lot of their ailments in of itself. So just being coming from my background and being in a neighborhood that's predominantly West Indian, that's a conversation that I try to have as much as I can. And I do participate in community events where I do talk about it. Diet is everything. Diet is absolutely everything.
And also, some of my patients are, scope of different ethnicities, and I'm also from the West Indies, from Grenada, and I know, even family members of mine or other, patients that are from the Caribbean, they say, well, I eat healthy, I have potatoes and green bananas and all these things, but they're dealing with diabetes. And well, my grandmother used to do the same thing. So why isn't, so then I have to go into and asking these questions. How did grandma get to the store? She walked, physical activity. How are you getting to the store now? Well, I drive. And so things like that in regards to physical activity, it's not necessarily about going to the gym. So sometimes, a doctor has so much time to deal with a patient in some of these facilities. So they don't get to go into a lengthy way of explaining some of the things that a patient can do. And really, that is like a passion of mine, and I really, really hope to see that come about. And the other thing is for, making it available for those who are underserved. They can't afford a lot of times having to pay for a health coach. So it would be nice somewhere down the line soon, you'll hear insurance that creating some sort of payment code for health coaches.
So Judy, I really applaud what you're doing as well. And I wish I would have met you about 5 years ago when I was the medical director for one of our wound centers. And because wounds are a manifestation of uncontrolled diabetes and habits and things. And what I realized is that, less important was my treatments and more important was really my entire team, getting the patients on board to change things and change lifestyle of different habits that they may have had. And it's such an important aspect of health, and that, health, of course, is driven by money, and there's not a lot of money that goes into that. However, I would go and say that there are people out there that are population health that are really looking to achieve some of the goals that you have in mind as well. And like Fidelis or Health First may be very interested in getting with you or liaising with you to connect with their patients. Here at New York Presbyterian Brooklyn, we have a patient navigator service, which helps people make appointments. But not only helps people make appointments, but tries to identify some of the barriers to getting to those appointments.
Yeah.
And we also have coaches from upstairs that do the same thing. This is just a primary ER. So there are kind of forums for that out there. I hope you have a social media presence, and because your message is outstanding. I hope you get it out.
Yes, thanks. I'm really trying on that. I am fortunate enough, thank God, to work for a union where our medical facility is funded by the union members. So I'm the one who would, because it's not everyone remembers their appointments. Not everyone sometimes want to come to that appointment. So I run a weight management program where I literally make the appointments for them, boost up their egos about what's going to be happening on your next appointment. You're going to lose weight. You're going to come back, whatever it is, you're going to have a good story. And really the day before that appointment, I call them again. So it's really, and we've done this because of the fact we saw when we first started the first year, how we were missing all these appointments, no shows. And so it's just having someone to encourage them that, listen, and sometimes some of them would say, oh, I didn't lose any weight, so I don't want to come back. No, you didn't gain any, so come. We'll talk about some things that maybe we can try, and that gets them to come. So, I mean, I hear a lot of people say, well, no one has time for that. But maybe we should make time for that.
Judy, that is really, it's really great to hear you doing that work. And I actually believe we may have met once or twice when you.
Yes, we did. Yes, we did.
And so what I'd like to do, Nate Shafinsky is on the line. Nate is our policy person for health. I think Dr. Bakari's advice was absolutely spot on. Your platform is something that some of the healthcare insurance providers would look for as they move their programs forward. And I heard Dr. Bakari mention like Health First, Emblem.
I didn't get the other name. So I heard Health First, and what was the other?
Yeah, I mean,
Emblem, Fidelis.
Emblem, okay.
Fidelis, yeah.
Yeah, it's any healthcare insurance company.
Right.
Because right now, what they're doing is they want to offer their people they insure, they want to offer them programs, right? and though that's where you get in, and that's the type of group, more so than a hospital that would look for your type of
Right.
service. But also, I think Nate can tell us a little bit. I mean, right now, our programming at Borough Hall has been cut. We're not doing any in-person programming.
Right.
But there are opportunities where I know the BP, and Nate can tell you more of, has done some things with healthy eating. And maybe, I think we have a pilot program, Nate, with one of the hospitals around wellness.
Yes, that you may be talking about the one at Bellevue, New York City Health and Hospitals Bellevue location.
Exactly.
Yeah, there's a plant-based lifestyle medicine program that was started.
So Nate, can you just tell us really quickly a little bit about maybe that that project?
Yeah, so that was spearheaded by the Borough President and in partnership with the city. And so it's through its first year of the pilot. And so it's headed up by Dr. Michelle McMacken over at Bellevue and some of her team, including lifestyle coaches and nurses and dietitians. And so they work with folks who are dealing with chronic disease, so heart disease, hypertension, type 2 diabetes, and they do, along with traditional medical monitoring, lifestyle interventions, primarily healthy eating, so how to shift their diets and their families' diets to a whole food, plant-based diet, and then they, while continuing the traditional medical monitoring, monitor their symptoms as they hopefully wean off of some of those medications, and as the Borough President did, ultimately reverse, if possible, a chronic condition that they may have been plagued with for many years. So I know they've had a couple hundred people that they have served up to this point, and they've had more than 500, I think, on the wait list. So there's significant demand and interest. And so I know we're also trying to get hospitals around Brooklyn and around the city to bring up that kind of model where you would have a pilot or some sort of a center where patients could go and along with their traditional care for, let's say, heart disease, get education and information and some counseling on how to transition their lifestyle habits, primarily diet. One other program item I wanted to mention, this coming Monday, there's a vegan and veg curious meetup. I'm not sure of the program topic this go around, but it's a quarterly program spearheaded by one of our colleagues in the office, Rachel Atchison. And so an opportunity for people who are curious about plant-based nutrition and healthy eating to talk to other folks in the community. And then there's usually a speaker that talks about different topics or presents a book, or we've exchanged healthy eating recipes and things like that. So, and if anyone has any questions, or if questions come up for Mike or others in the chat about plant-based nutrition or healthy eating and resources, feel free to reference them my way, and I can make sure they get the right information.
Thank you, Nate. Really appreciate it. We thank Nate for all his work. He helped us as in getting some of the doctors together for this call because he has those contacts. So thank you so much. Mike, we have some more questions, right?
I have a question that's directed to Dr. Moise.
Yes.
And I hope it's not too personal, but as a doctor and a COVID survivor, what can you tell us about having the disease, and what did you do to make yourself better?
So my disease course was on the mild to moderate side. I did not have to be hospitalized, thank God. And the type of symptoms that I had, I basically had symptoms for about 2 weeks, and which included, body aches and loss of taste, loss of smell, had some chest pain here and there, a little bit of hard time breathing, but nothing too concerning, and barely had any fever. So after that, I did develop a bronchitis. So, but that does happen to me from time to time. I may get a bronchitis every couple of years. So I basically was coughing for like about a month and a half after the 2 weeks. But it wasn't the cough, it was just kind of like in the morning or at night. It didn't stop my day or anything. So I pretty much got over most of the symptoms after the 2 weeks, and I didn't have a fever, so I was able to go back to work. But as a survivor, I think the biggest thing I learned, of course, like treating it and then having it at the same time is helpful because I could share my story with my patients. So I think one of the biggest things I probably learned was that the symptoms, they linger, you know, so, you know, like the loss of taste, the loss of smell, I wound up having, that actually lasted for, well, the loss of smell lasted for about 2 to 3 months. And it slowly came back, you know, little by little. So that's one thing that we, you know, that we have to deal with when we have it. And, but I'm very thankful because I certainly could have had a lot more severe symptoms. Like, you know, I could have been hospitalized. So thank goodness it was, you know, it was on the more, you know, mild to moderate side. So, but, you know, I survived it, and I'm hoping I don't get it again. But however, you know, that's not going to stop me from doing what I'm doing. I'm sure Dr. Bakari will agree with me. You know, we signed up for this. You know, especially we're ER doctors and Baffords, if you're familiar with that term. So, yeah, we signed up for this. We're ER doctors. If this, you know, if we have a bad wave again, I'm going to be there. Dr. Bakari is going to be there. We're going to be on the front lines just like we were before, and we're going to do what we have to do. That's the way I see it.
Okay, great. Another question that came in that I think comes up a lot during this is, what are the doctor's thoughts on kids going back to school?
Well, for my marriage's sake, I hope they do go back to school. You know, that's a very difficult question. It is. And I don't have the answer. I don't know. I think that right now we're seeing about 1 to 2 patients a day that have COVID, maybe. All right. And at some point in time, we have to get back to our normalcy of life. And, you know, we've been scared of our friends and family and connections. And, you know, at some point in time, we have to venture out there. My personal opinion, and I'm not basing this off of medical, and this is just purely my personal opinion, is let's do it. Let's go back to school. Let's get the kids in. It's so difficult for especially teenage kids. It's so difficult for kids who rely on the schools to eat and have different programs. And we're letting our kids, you know, kind of down in a sense, I believe, because we have to support them better. And in some aspect, kids need to go back to school. But like I said, that's not a medical opinion. That's my personal opinion. If there is a resurgence of COVID, we do have room. And if we need to shut down at that time, I do have confidence that we could shut down at that time and pretty much, you know, quarantine again. But we have to hope.
So I think I agree with Dr. Bakari that there's no perfect answer to this. It's a very difficult question. I think it's going, in terms of how this is handled, I think it's going to depend on the area that you're in, because if there's a high incident, and, you know, and once again, this is just going to be based on my opinion, because there's no perfect answer to this question. But if you're in an area where the incidence of COVID is high or the cases are continuing to increase, then you may want to consider holding off on opening up school. I think for New York in particular, because we have it under a decent level of control at this point. I think, you know, one option is to maybe do that the half and half method, where you may have the kids in school for half the week, and then, you know, the other half of the week they would do the remote learning. I think that's a decent option. It's not perfect. And I also think too, while the summer months, or while we're still warm outside, I think that schools should consider, if possible, if they have the space for it, to do certain classes outside if possible. You know, just kind of take advantage of the weather as much as they can while, you know, because I mean, you know, we kind of deal with the whole global warming thing, and it is warmer a little bit later into the year than we've had before. So, you know, so that's something to consider. But it's a tough one. It's really a tough one.
You know, one thing I have to say, Dr. Moisey, that I'm impressed with is really your outreach to the local community church, because really it's so important to be able to isolate and identify and then isolate. And that's how we're going to be for the next year and a half. So doing those kind of outreach to the community is fantastic. I super applaud you, and I will help you in any way personally that I can if you need it.
Thank you. I appreciate that. I appreciate that. And of course, you're doing wonderful work in the hospital.
Oh, stop.
Which is just as important. But I think, you know, we have to hit them from all angles, right? You know,
Yeah,
we're hitting
absolutely.
from the ER angle, we're hitting them from, you know, from the streets and the community. So we got to keep pushing on to keep those numbers low.
Great. I think most and nearly all questions have been covered. So without further ado, we are going to end the meeting. But before we do an official end, I'd like to ask, with your permission, everyone here, if you're okay that I could try to capture a screenshot of everyone here.
Sure.
Okay, I'm gonna try with my laptop here. There's a command I just have to press. So let's look at the camera all nice and pretty. 1, 2, 3. I don't think it did it. So let me try one more. Okay. Oh, it did do it. It just delayed it. So let me do one more. I'm gonna just drag and drop all the way down. Ready? Okay. Okay.
So much. Thank you, Dr. Bakari, Dr. Moise. You know, we have done these 3 sessions. We're actually looking to do a few more. You know, I'm a little concerned our attendance doesn't come up. I think people RSVP for things and then don't show up. But, you know, we have had some of these. I see some of the names of people who've been on with us for all 3 sessions. I believe, Stephen's been on, I think, every session. You can unmute yourself, Stephen.
Yeah, just a couple. Hey.
And you know, we do want to continue these conversations. So I thank both of you. I thank my team for getting on and those who've joined. And you'll be hearing from us, I'm sure, again soon. Glenda?
Yes, I echo everything that Lori has said just now. And thank you both doctors for coming on today to give us some very critical information, advice as how to, you know, treat ourselves and prepare ourselves with respect to COVID. So this is the last session as part of our series that we had this month as Wellness Wednesdays, but we are definitely looking forward to hosting future series. So we hope that we can count on you, maybe that you could be a part of a future discussion.
It's truly a pleasure. It really is. And I thank Eric for putting this together, and you guys, and just reaching out to the community. And I'm super impressed with you, Dr. Moisey. So I look forward at some point in time to meeting face to face.
Yes, definitely impressed with you as well. It would be great to meet you. Absolutely. And yeah, I want to thank BP Adams for putting this together. I think that these forums are important to have. And we, you know, I certainly love doing these forums and informing the community in any way that I can. So if you need anything else from me or from Dr. Bakari, I'm sure we'll do it for you. We'll work something out.
Thank you both so much. Thank you.
Thank you, guys.
Thank you, guys.
See you, Dr. K.
You're welcome. Have a good one.
See you.
Thanks, everyone. Thanks so much.
Bye, everyone.
Bye.
Bye.